What you and I are both looking at right here in this bar and whisker chart is more than just numbers. What we're looking at is an incredibly eloquently designed research study in which it was randomized, triple-blinded, controlled study, RCT. And the thing about this that's quite amazing is this. It happened between the time, I should say, during a pandemic, between November 2021 and February 2022. And what you have here is two groups. One group, you notice I have the arrow pointing at. Those are third-year med students during this trying time, which were exposed to biochemical challenges, let's say. So they worked in the front line, hospitals, clinics, and so on and so forth. So they were out and about toiling hard to keep people healthy, but on the front line. The other group, per se, was basically your health science students, first year, which spent a lot of time in lecture halls in certain areas like that, like the type of pandemic stuff that was going on, no touchy-feely, so on and so forth. So you really have to focus on the med group there. And the beautiful part of the intricacies of this particular research is they even looked at the group of participants in regard to how they were born, how they were fed, childhood infections, so on and so forth, inoculations or vaccination records, and so on and so forth, because all those could play a role in potentially confounding the outcome. For those familiar with it, alterations of microbiome, depending on how a child was born and fed, and so on and so forth. So this is quite amazing. And yet, even after all this, they achieved a significant outcome. I shouldn't say achieved. You have an alternative hypothesis, but we witnessed a significant outcome in regard to colostrum supplementation over about 107 days at a mere just 500 milligrams, half a gram, to 1,000 milligrams, a gram per day, again, off and on for a total of about 107 days. Went for about 87 days, they stopped for a while, then they resumed. Again, finding out the effect after they stopped for a while and resumed was actually quite even more prolific, more substantial, or substantialer, in regard to the colostrum supplementation. So, without having to indulge me any further, the explanation in regard to this incredible, eloquent, intricate research, which, if you indulge me for a second, once again, it is like, often what we do is, this research is incredible. What we do is like reading a book backwards. We look at the last page, look at the outcome, we close the book. But the real part of discovery is the journey. Start with the introduction, you go through it, you go through methodology, so on and so forth, and you develop an incredible appreciation for well-done data science. So, let us get right into the research as follows. And without having to go further, with this patient, it was just 500 milligrams to a gram of colostrum per day in individuals which are under stressful environmental conditions, exposed to other individuals which had a myriad of other viral or bacterial challenges, and it yielded a substantial result in regard to mitigating the effects of upper respiratory tract infections or infection as a whole. Henceforth, there it is. And you can move on. Now, to get more into the story, let us proceed. Here we go. And I don't mean to be blunt in regard to it, but still, just in case you're short on time, and you can always come back and review the rest of the research later on. But to proceed, moderate dose bovine colostrum supplementation and prevention of upper respiratory tract infections in medical university students, a randomized, triple-blinded, placebo-controlled trial. To start with the abstract, we're just going to cherry pick some parts here and get into the discussion in a second. Homogeneous population of medical students at risk, third-year med students, and health science peers were supplemented with a relatively low dose. Most of the studies in colostrum were done with 6 grams, 10 grams, so on and so forth. Here we're just looking for those penny pinching. 500 milligrams, just a gram, that is it. A bovine colostrum or placebo over 45 days, and then once again over 7 days starting at day 87. The trial lasted 107 days. To reiterate, overall, it can be concluded that young, healthy people seem to have sufficient defenses from upper respiratory tract infections. That's a URTI abbreviation. Now, To reiterate also as well, or to review, remember, it happened during November 2021 through February 2022. And there were a lot of pandemic mitigation strategies out there, which resulted in a far lower upper respiratory tract infection seasonal outcome in regard to the general populace. So that did not give them the biggest space to work with, but yet the outcome was still significant. But to proceed, it says overall conducted based colostrum supplementation can provide significant support and protection among those at higher infectious risk. And that was real world. We're not just dealing with athletes, we're dealing with third-year med students working in the field because of exposure to a heavy workload and increased contact with infectious agents. That's the abstract. Now we go into the discussion. On a read through here, I know it's kind of, melodic, but still just the same, it's important. One very important benefit most typically attributed to colostrum has always been the improvement of immunity, which is best expressed as a reduction in respiratory tract infection frequency and or severity. I promise I'll slow down. This was tested in several experiments, some which have been double-blinded placebo-controlled trials performed mostly with athletes or at least physically active participants because of the stress on the system. They want to see exactly if we put the person to the test. Normally the immune system tends to be compromised in a stressful event, so it's easy to test colostrum that way. In this case, we tried something different. Although the results were mostly in favor of colostrum preventing the respiratory tract infectious events, the choice of trial subjects and other parameters have made the results difficult to apply to the general non-athlete population. Quote, our results come from the first ever double-blinded placebo-controlled trial, actually triple-blinded, with such large, highly uniform adult non-athletic populations performed in one location and within the same time frame to produce the most coherent epidemiological conditions. All previous trials testing the influence of colostrum on the development of URTI, upper respiratory tract infections, differed from our work in regards to some of these experimental design characteristics. We made this effort, of course I'm quoting, because as much as keeping such strict experimental conditions is challenging, it is crucial for obtaining credible and accurate results, especially with epidemiological trials assessing prevention from infectious diseases. So they want this airtight. And you have to agree with them. If you're into data science or the researcher or so on and so forth, there's tons of studies out there. And you can pick any study you want to make any argument or any outcome you desire. But the quality of those studies, unfortunately, is less checked. And we are overpopulated with studies which need greater review. To proceed, an additional factor that differs our study, quoting, from previous trials is that we used much lower dose of colostrum. Most other experiments of similar design use daily doses of 10, forgive me, I said 6 to 10. It was meant to 10 to 60 grams, whereas our doses, quoting, of course, 500 milligrams twice daily, followed by 500 milligrams once daily. Such low doses were previously tested in our trials and were aimed at downregulating intestinal permeability in athletes, and they turned out to be highly effective in this regard. You have to remember, colostrum is also affecting the junction part in the intestinal tract. You notice how colostrum has also been researched in helping athletes with temperature extremes, heat shock, and so on and so forth. Real interesting thing to delve into. Colostrum is multifaceted. Faceted is multifascinating, but as well faceted element as far as a nutritional strategy for exactly that, extreme conditions. In their case, the extreme condition was pandemic. All right, methods. Now, if you look at the methodology right here, I want to, again, indulge me, to show you exactly the background I looked at other participants. It may not seem like much in the beginning, but as you begin to weed through these things as far as looking for confounding, it can have significant importance later on. But that is great research. Also, the methods. The trial was third-year students and attended practical classes in hospital units and outpatient clinics on a regular basis, which created a higher risk of contact with infectious factors. The majority of our health science students, no insult to them, were first-year students and had most of their classes held in lecture halls, dedicated classrooms, or online settings. Henceforth, probably lower than normal upper respiratory tract infection rate that you normally see seasonally, and they put that as part of the limitation of the strategy. where they thought they would have had even a greater impact with the health science students. But if you're not out and about, your chance of infection tends to be a little lower. So we focus more on the med students, which are actually out and about and toiling around. Here we go. And so the supplementation packages of 90 unlabeled sachets, remember, placebo-controlled as well, containing either colostrum or placebo prepared by pouches containing 500 milligrams. No, I don't mention brand names. 500 milligrams of freeze-dried bovine colostrum collected within the first 2 hours of calf delivery was mixed with 500 milligrams of desiccated banana, baby food. Placebo doses were 500 milligrams. Sounds like baby food. Not that there was baby food. Placebo doses were 500 milligrams of spray dried whey mixed with 500 milligrams of identically dried out banana. Such an assortment of supplementation materials effectively used in the previous experiments. Let's just go straight to the conclusion. And it's quite enlightening. Here we go. Our trial, quote, begins new insight to the issue of colostrum effectiveness by providing evidence that in contrast to general healthy population in young adults, subpopulation, those exposed to certain challenges which increase the risk of developing URTI, upper respiratory tract infections, can significantly benefit from using colostrum supplementation. To confirm this general notion, several particular conclusions can be drawn from our trial, quoting, 1. Colostrum supplementation significantly decreases, I mumbled, the number of days with symptoms of URTIs, upper respiratory tract infections, registered in young, healthy population and increased risk of developing URTI, the third-year med students, versus population of their peers, first-year health science students, with no elevated risk because they're at home doing online training of such infections. 2. The reduction in severity of URTI symptoms is observed upon supplementation with colostrum in our third-year med students out and about, versus the health science group as well, sitting at home doing online classes, the oral lecture hall. 3. The well-being is also significantly improved in the third-year med group, supplemented with colostrum when compared with such supplemented health science groups. The above effects can be obtained with much smaller doses than in previous trials of parallel design. And 5, there were no serious side effects among those receiving colostrum in all participants of our trial, as well as the non-gastrointestinal symptoms have appeared among them with higher frequency than the placebo group itself. So you have an incredibly well thought out, detailed, intricate research study in regard to colostrum working to reduce the severity and the frequency of URTIs, upper respiratory tract infections, at a marginal dose of 500 milligrams to 1 gram for a certain number of days. Then they stop and they start up again and still yield some quite incredible results. You will have to delve more into the research on your own in order to see exactly how great those results were, surprising even to the researchers. But in a real-world setting with people which are highly stressed, not just athletes, third-year med students, which are actually dealing with, obviously, people with, or I should say, individuals which have infectious diseases as a whole, and yet it yielded them incredible results. So substantial or significant outcomes in improvement to their health. Also, one thing I did not address as well, and it's kind of like a side benefit, there was an effect in also helping maintain a positive mood, which, significant effect. It looked like it was higher in the median. It, looking at the confidence intervals per se, making sure they weren't eclipsing each other, looked to be pretty positive. But I would like to see those results obtained and reviewed when there is more regular seasonality or regularity to the URTI infectious rates in a normal, less pandemic-ridden time. So, normal seasonal allergy or respiratory infection season, so to say. And so it was quite amazing. So it yields a lot of benefit, which makes sense too, because if the colostrum is yielding benefit on the microbiome level, as well with the intestinal tract, obviously that's been shown to have a positive impact, provided it's beneficial bacteria, on mood. So again, gratitude for the painstakingly done, intricate, incredibly well-detailed research that the researchers had conducted and brought to our attention without being too repetitive. And also, too, as always, I am humbled you watch.
And once again, to reiterate, I'll see you all once again next week.
Thank you. And link will be there on the YouTube channel. For those not familiar, those on TikTok per se, I don't link it on there, but if you find the YouTube channel, my YouTube channel, or our YouTube channel, because I'm not a channel unless there's other people watch, you'll find it. Catch you all next time. See you then. Bye.